We're talking about the gut. It's big, it's like a key word, but it's everything. And it starts with our mouth. Of course, women are at an increased risk for irritable bowel syndrome, as well as bone loss in our jaw. There are a lot of studies that have shown that bone loss in our jaw area, it can be connected to our GI health. So why are these things, why do we separate them? First of all, let's just start with the fact that our mouth is part of our gut. The GI system starts with the mouth, and everything that goes inside that mouth works its way down the esophagus to the stomach and to the colon. So, you just want to think about like how we get our nutrients, and it starts with what we eat. We learn this when we're kids, food pyramid and what to consume. And we make our children eat those things, Brussels sprouts and leafy vegetables. And that's why I just want you to take a walk with me through our anatomy. Today we're kind of going to touch on anatomy, biology, physiology. Everything that goes on with that gut is from what we eat to how we feel to what we do. And there are connections to our genetics, what we have in our DNA, mutations, and just, family history. So it's important for us to think about the gut. All right, so the oral microbiome, you guys might hear this and it sounds all scientific, and it is. It's what's in your mouth and what keeps us healthy. And that is the bacteria, the fungi, the viruses, and the cells, like everything inside that mouth. So when we talk as dentists, when we talk about plaque, bacteria, we're talking about bacteria that we know causes problems. Now, no matter what you do, you're not going to get rid of all the bacteria. I mean, there are trillions. There's so much stuff in the mouth. It's not about the Listerine. It's not even about brushing your teeth. But what we want to do is keep it in a healthy balance. And that balance is also important in the gut. So the GI doctors will tell you the same thing. There's a whole bunch of stuff down there. And, when babies arrive, they have a sterile gut. Nothing is in there to help them. And their immunity is developed over time. And over time, we collect bacteria, fungus, everything that seems like bad, it is inside to help us digest food and fight disease. But it has to be at a good balance. And so too much of one thing is not good for your health. So keyword diversity is actually good for your mouth, and diversity is good for the gut, your body, your overall health. Take a walk with me in terms of just the idea of mealtime. I mean, you're thinking about going out to eat, or somebody starts talking about what they're cooking for dinner, and you start getting excited, right? Emotionally, you're remembering these smells and these tastes and the food and all the different flavors, and you start salivating, right? Like someone says apple pie and you start salivating, and that is part of our, our salivary glands, our parotid glands inside of our cheek, and our sublingual gland underneath our tongue. That thing is like a water fountain. Ask any dentist all day. We're like, ooh. Even when you're nervous, it triggers that salivary gland. Our submandibular glands underneath our jaw, all of those glands secrete saliva that has enzymes to help us break down starches and break down fats so that we can get the nutrients into our system. So we're thinking about food, and what happens when we finally get that food? We smell it. So, smell and taste are related. Our brain's really excited. We start secreting more saliva, and we take a first bite of that food. We taste it. So we have our taste buds, right? Our taste buds are on our tongue. They're also in the back, the top of the esophagus, our palate, the roof of our mouth. Our taste buds, sweet, salty, sour, bitter, savory, all of those different responses to food to help us with digestion, right? So things that we like to eat that are savory, that's how we add spice. We add things that we may not necessarily like. Brussels sprouts, they're one of the most popular dishes because we learned how to prepare them to make them more savory, so that we enjoy eating them, so that we can get the nutrients for our system. All right, so we're chewing. Hello, teeth. Teeth are in the mouth, right? We've got our tongue, we have our cheeks, we've got our lips, and our teeth. Our teeth are actually designed anatomically to break down food. So our canines have those shearing peaks, and our incisors have that sharp edge. Our molars have cusps for crushing and grinding food. So now we're all in that mouth. We're already in the gut. We're in the GI system. We're chewing, we're salivating, we're breaking apart the food, we're breaking it down. And then our muscles of mastication. I mean, I feel like I'm in dental school right now. Our masseter muscle and our buccinator and all those, I think there are 28 muscles in the face, 27, correct me if I'm wrong. All of those, everything from that stern chin, the mentalis, everything, how we raise our eyebrows, sucking, chewing, tasting is done with all of these muscles in a nice coordinated fashion. Now, what happens if you don't have your teeth? You think you're going to break down food the same way? Do you think your body's going to actually get the nutrients that it needs? What if you have dry mouth? Women are at an increased risk for dry mouth. It could be autoimmune, it could be from Sjögren's syndrome, or it could be from, depression medication. It could be from our moods. It could be from an imbalance of emotions, time of the year, weather changes. A lot of things could be genetic, but they could also be environmental, and it's with our mouth and our gut. So saliva is really important. Women, we always think, oh, this happens to everybody, but women, things happen to us in a special way. Look, I'm 45, okay? I just had my colon screening. We have to pay attention to what's in our family history, and we also have to pay attention to our behaviors, our environment. And that's why I feel so inspired, because I have learned about things from school, but also through living and through seeing patients over all these years. And I really noticed that dry mouth is a big thing. I see it in increased prevalence in women, especially as they age. All right. So we've gotten that food down into our gut. And so, then our GI system does its thing. Peristalsis, like all the muscles move things around and it breaks it up, and the stomach does its thing. And then, you go to the bathroom and you live your life. Wow. Seems really simple, but a lot of things have to go into keeping it at a healthy balance. One thing about us is that our body has self-correct mechanisms, just like cavities. Saliva goes in and tries to repair things before they get bad. But if you do all the bad things all the time, if you just eat chips and you don't exercise and you don't sleep, well, what's going to happen over time? Your body's going to, start to give up, and your body can have autoimmune responses. And so when we think about the mouth, what's the biggest thing we talk about is gum disease. So that is caused by too much bad bacteria. So you've got bacteria that can live without oxygen, bacteria that is more aggressive. And what we see is inflammation of the gums and bone loss. And so there are a lot of studies that show that the same steps that cause gum disease can also cause irritable bowel disorder, diverticulosis, things that cause problems in our abdomen. And so that's why it's really important for you to pay attention to what you see in your mouth, such as bleeding gums, as well as abdominal pain, discomfort, GI disturbances, and to just understand that there's biology and then there's also behavior. So they say that sleep is really important. I struggle with this myself. I like to do a lot of work at night. Once my son is asleep, I feel like those are my hours where I'm not disturbed by anything else. And I don't get enough sleep. Then I get up early and I work out. But sleep is when our body repairs itself. So if we're not sleeping enough, we're not going to give our body a chance to actually repair, to do cell repair, right? All of those things are going to go into keeping a healthy oral microbiome. So stress, sleep. So let's talk about diets. What can we do? We're just going to eat everything healthy all the time. I know they tell us give up this, give up that, give up sugar. If you gave up sugar, you would never get a cavity, right? So it's very difficult. But what we can do is think about two types of foods: prebiotic, which is vegetables and whole grains and beans, legumes. And then probiotic, which is sauerkraut, pickled vegetables, kimchi, if you like Korean foods, yogurts, kefir. A lot of cultures, they enjoy yogurt as part of their meals to, whether they're eating pastries or meats. And our culture here, our Western diet is not healthy, right? So a Western diet has been linked to gut problems. Well, what can we do to correct that? We have access to all kinds of foods. We can buy more vegetables. We can eat more whole grains. And we can also do things in terms of our behavior. We can walk. We can exercise. In the dental community, we do a lot of sitting. So it's important for us to get up and stretch. And we should talk to our patients about this. If you're sitting at a computer all day, that affects your GI system. It's not just that you ate well, but also your mobility, moving around, and also allowing your muscles to to move so your body can actually get the inflammation out of its system. When we think about autoimmune responses in the mouth, we think about gum disease, but in terms of our gut, everything that we eat, that we consume over time will impact our risk for heart disease, diabetes. More research shows that women, we have silent indicators of heart disease, and we need to really pay attention to things that we withstand over time. And so our behavior, getting sleep and rest is really important. So if you feel like you have obstructive breathing during your sleeping, or you're grinding your teeth, talk to your dentist about this, because we want to make sure that we're doing what we can on the front end to make sure that you are actually going to have a healthy gut and a healthy body. So if you're missing teeth, unrestored teeth, broken down teeth, that's really important. Gum disease is going to put you at a risk of early tooth loss. And if you lose your teeth, replacing them with implants or other prostheses that can help you chew food so you can get your nutrients are really important. We want to also consider medications. We give antibiotics often when we see infection, but antibiotics, they get rid of everything, right? So they'll sweep that system and get rid of all your bacteria. So we want to be really mindful of our diet when we're taking antibiotics. That's why, yogurts are important and probiotics are important. Our gut health starts with our oral health. And so you want to think about that. And then, of course, looking at your waste products, and looking at your secretions, looking at what things are supposed to look like versus what they do, and talking to your providers, having your colonoscopy, looking at your gut health, talking to your physician, your family physician, about any disturbances, any symptoms that you feel draw your attention. On the dental end, we want to exercise good oral hygiene, brushing and flossing. Mouth rinses, be mindful. Now, there's a lot, I see this like, oh, don't use mouth rinses, it's going to kill all the bacteria. Like I said, your mouth has billions of bacteria in there, so a little Listerine is not going to wipe you out. However, if you are at an increased risk for gut problems, GI problems that you and your doctor have described and you understand, then you can use a mouth rinse that may not be as aggressive. Salt water does the body good, believe it or not. So you want to talk to your provider on that end so that we can make sure that you are pursuing your best smile at home and your best GI health. Thanks for tuning in, and I'll see you guys next time. Bye.